Hello, this is my concept map for neurology medication. I went with levetiracetam or Keppra. Its classification is it's an anti-epileptic and an anticonvulsant, and its route is by mouth or IV. So moving up to the mechanism of action right here. So it binds to the synaptic vessel protein SV2A and modulates neurotransmitter release, which then prevents abnormal neural firing, which prevents the seizures. From there, we'll go to the therapeutic indications. So partial onset seizures, myoclonic seizures, generalized tonic-clonic seizures, and then the ultimate goal is to reduce or prevent the seizure activity without sedation. Going down to the therapeutic effect, which I did connect, reduces seizure frequency, improves neurological stability, and it maintains alertness and cognition. And it's evaluated by the client reports fewer seizures, normal neurological status, and then no severe CNS adverse effects. Um, so then going down to the drug interaction, so it has minimal, but CNS depressions, alcohol, opioids can increase the sedation. And then client teaching is definitely to avoid alcohol or sedatives. And then that one is going to be connected to the pre-administration assessment. So we're going to be assessing the baseline mental and neurological status, the seizure frequency and the type of seizure they're having, the renal function, so the bun test, and then the creatine, both of those lab works, and then the mood and behavior history. And then that just helps us connect the dosage decision and risk of adverse effects. So from there, we'll go to I'm actually going to jump back up over here. So right in here, we're going to go to the adverse effects. So some common adverse effects are going to be fatigue, dizziness, headache, and drowsiness. And then some more serious adverse effects are going to be suicidal ideation, psychosis, Steven Johnson syndrome, pancreatopathy, and hepatotoxicity. And then so some pre-administration assessments are going to be to monitor the health stat or monitor mental health status, the CBC, the liver, the renal lab tests, which are going to be that bun and that creatine lab test, and then just the client teaching, reporting any mood or skin changes, stuff like that. Um, so then from there, we're going to jump back down here to the nursing interventions. So monitor mood and behavior changes. So we need to prevent self-harm and mental health crisis. Um, Assess renal functions regularly. So drug excreted renally, adjust dosage if impaired. So checking those labs, implement seizure precautions, prevent injury during possible breakthrough seizures. And then that connects to the client safety, effective treatment outcomes. So going back up in here, so the evaluation of efficiency, which is connected to the nursing interventions. So decreased seizure frequency and intensity, no suicidal ideations or severe behavioral changes, and then stable renal function and mood. And then clients verbalizes understanding of regimen. Client teaching, take medication exactly as prescribed, do not abruptly stop, report mood changes, depression, or suicidal thoughts immediately, avoid alcohol and operating heavy machinery, maintain adequate hydration, and attend regular lab follow-ups. This connects to the adverse effects, toxicity prevention, and compliance. So from client teaching, we're going to go to the administration considerations. So oral with or without food is fine. IV, dilute and infuse over 15 minutes. Adjust dose if renal impairment, and then consistent daily timing for steady blood levels. And then this connects to the monitoring, the teaching, and the evaluations. So we're going to move up to the signs of toxicity. So sedation, agitation, confusion, ataxia, and suicidal thoughts. And then those are going to connect to the client teaching. So that we got to make sure that they're reporting mood and behavior changes and that we're monitoring for that and that we're monitoring the mental status. And then another thing to watch is the gait, which could have an effect on the sedation and the confusion, just kind of seeing how they're walking and maintaining their regular way going about. And then from there, we're going to go to clients at increased risk. So older client adults are going to be at an increased risk with an elevated CNS sensitivity. Clients with renal impairment, I mean, it's super important that we're watching those labs and monitoring those bun and creatine levels. So obviously, if they have a renal impairment, that is an increased risk. Clients with psychiatric disorders. So again, mental health status is one of the biggest concerns that we have throughout giving this medication. So if we know that they're already at a psychiatric disorder, it's definitely good to monitor those. And then this just connects to the being able to adjust the dosages to make sure that everything's working properly, assessing the moods, and monitoring the renal labs. From there, we're going to go up to this box, which would be our last box. That's going to be monitoring assessments and after administration. So with this one, we're going to observe for any CNS effects, so confusion, dizziness, mental, um, cognitive status deteriorating, any behavioral changes, changes in gait, changes in moods, anything like that. Skin reaction, so labs. So we're definitely going to be checking those renal labs and renal functions for sure. And then the CBC. So we need to make sure that the liver function is okay. And then again, the bun and then the creatine. So liver, just more of the pharmacokinetics. That's what we're focusing on there. And then that connects to being able to detect toxicity early and prevent any complications that may arise from this medication. And then down in this corner right here, I'll have all of my references and citations. And yeah, that is my concept map. Thank you so much for taking the time to watch.